So I've decided to give you an overview of cardiovascular disease by screencast because I think a lot of you, this will be very familiar stuff. You'll have done it in your undergraduate degrees. But also I want to allow more time to actually have some discussion about the practicalities in the session. So let's just start having a think about what we mean by cardiovascular disease because it covers a whole range of things. So the vascular aspect is the atherosclerosis that comes about through a range of factors, but including high-fat diets. And so the vascular system is getting harder, less flexible. We get plaques on the blood vessels. So all of these things causing damage, smoking, all that kind of stuff. So arteries become damaged. And that is a precursor to heart attack or heart problems. Coronary heart disease is when your coronary arteries, so the ones actually supplying your heart with blood, with oxygen-rich blood, become narrowed by a gradual build-up of the fatty material, the atherosclerosis. A stroke is one of two kinds, ischemic and hemorrhagic. So hemorrhagic is a bleed. Ischemic tends to come when something like a blood clot blocks an artery, and therefore the tissue behind it, where the blood isn't getting through to, becomes hypoxic and it gets damaged by lack of oxygen. So that bit of the brain, because we're talking with strokes, we're talking brain, that bit of the brain becomes damaged. So it's either a bleed or it's lack of oxygen due to some kind of ischemic accident. So do have a look at the YouTube video to try and get an understanding of that. The acute heart attack, also when you get the blood vessels blocking for some reason, you get pain, you get the blockage, and behind where the oxygenated blood can't get, a bit of the muscle dies. So it's really worth thinking through what that might mean. And clearly some of those are fatal, but a huge number of them are not. But what people who recover from a heart attack often have is that bit of damaged tissue, and it can happen over and over again. So people become progressively more damaged, their heart becomes more damaged, and they end up with heart failure. So the heart is not pumping well enough. You get pooling of fluid in the ankles and that kind of thing. So people become progressively more disabled. There's a whole range of inherited conditions affecting the heart muscles and heart valves, and there's a whole host of different things that cause abnormalities in the beating of the heart. So there's a lot of different things that we need to consider and be aware of. Strokes cause, of course, huge level of disability. So that is the biggest cause of disability in the country. So that has a huge impact. And a lot of you will then find yourselves in your careers working with stroke patients who need nasogastric or PEG feeds because of unsafe swallow. So the impact of stroke is really significant. And you may not know that actually at least I can't remember the exact figures now, but young adults are quite prone to sudden heart attack and sudden death. So you might have seen that in a few footballers recently, but it's not at all unusual. At least every month, a young person is dying of heart disease, and that's something that's usually been undiagnosed. So there's lots of different things to think about that might cause heart problems. And they're not all lifestyle related. Some, of course, are. Many of them are. So just have a little bit of thinking of the structure of the heart. This is just a reminder for you if that's not something that you're very familiar with. But remember that the biggest area of damage is the coronary arteries, those big arteries that are providing oxygenated blood to the heart. So heart failure, as I said, people often just think, oh, heart attack, you have one of those and then you're fine. But heart failure is classified into different stages, and that's all to do with the limitations of what it actually means as far as your day-to-day function is concerned. So some people will have a heart attack, they will recover, and it doesn't appear to have made any difference. So they can do anything that they could do before, no fatigue, no breathlessness, and those kinds of things. Class 2 is that slight limitation of physical activity. So people might be absolutely fine at rest, but ordinary physical activity, such as walking and gardening and doing just general day-to-day activities, can lead to people being fatigued, having heart palpitations, feeling out of breath, or getting angina, which is that pain, which is often due to low oxygen levels in part of the heart muscle. So really worth being aware and thinking through that just because someone has had a heart attack and recovered, they may not have fully recovered. Class 3 is where people have a marked limitation of physical activity, so they may be comfortable at rest, but anything beyond ordinary activities is going to lead to symptoms. So symptoms are a part of normal everyday life for those people. And then the class 4 is the inability to carry out any physical activity. So people are severely breathless, they may get congestion, so it's fluid in their heart muscles, even at rest. Any physical activity can be painful, and so the breathlessness means that people are very immobile. So a very severe impact, severe disability, severe impact on everyday life. And the breathlessness can make it really difficult for people to eat. So sometimes in kind of end stage heart failure, you may end up providing nutritional support to some patients because they can't eat, because they can't breathe. And the extra work that the heart is trying to do and the lungs are trying to do increases energy expenditure. So people are feeling very tired. They may have swollen ankles and legs. They may need to be on fluid restrictions. So that is something that you are likely to come across, which people are often a bit less aware of than heart attacks. So where are we with our current trends? So 7 out of 10 of the top leading causes of death globally are non-communicable disease, and ischemic heart disease comes right at the top, stroke second. So if you put all of the deaths together, cardiovascular disease is the main cause of death. Different countries have different incidences, so it's worth looking at that. That website's quite fun. You can look up your own country and find out what the death rate and what is the greatest, where we fit on the list of 1 to however many countries. UK is quite low in comparison to many other countries, but it's worth having a little look. The WHO do a lot of work globally to try and prevent heart disease, and that initiative is all about prevention and control of coronary heart disease, or cardiovascular diseases, should I say. So the causes of cardiovascular disease, whether it's affecting your brain with a stroke or with your heart, are pretty similar. So what do? We need to look at tobacco, we need to look at physical activity, salt consumption, trans fats, and so there's a real need to try and do prevention work in primary care to decrease the incidence of cardiovascular disease in the first place. So that's what they're trying to do there. If we're looking specifically at the UK, 1 in 4 deaths due to heart and circulatory diseases, and about 7.6 million people living with cardiovascular disease of some description. Coronary heart disease, so those arteries that I mentioned, that's the most common one, and the single biggest killer of both men and women worldwide. So 100,000 hospital admissions, so massive impact on the health service, and about 1.4 people who've actually had a heart attack and survived. More than 900,000 living with heart failure one of those grades. So big impact on the health service, a big impact on people's lives and the cost of social care as well, because of the level of disability that is caused by cardiovascular disease. So just this diagram just gives you an overview of the causes of death across the UK. Just shows you that heart and circulatory diseases are a massive part. You've got actual numbers there. Cancer causes 28% of deaths, so that's very significant too. So big numbers of people affected by cardiovascular disease. And just to kind of put it all into the context, as we go through this module and we talk about obesity and metabolic syndrome and hypertension and type 2 diabetes, you can see that there's going to be some overlap, which just kind of makes you realise how important the aspects that we are control that try and prevent some of these things. So there's a lot, you may think, oh, she's told us this before. It's just to kind of re-emphasize that point. They're relevant points to each of the different things that we're looking at individually. So we've got the obesity, we've got type 2 diabetes, which is related to insulin resistance, which is of course related to obesity, particularly abdominal obesity. We have hypertension, which is leading to damaged artery walls, so that impacts also on the atherosclerosis, which the poor diet does as well, or the high cholesterol levels, which are genetic as well as dietary related. So we've got all of those things to consider. We will look more closely at the dietary sources of cholesterol. They are very small and very insignificant for most people. But it is interesting that at least 1 in 10 people are sensitive to dietary cholesterol, not just saturated fat. So for some people, the dietary cholesterol sources are something that we might need to look at. And there's a really interesting paper done by Bruce Griffin on eggs. That's a few years ago now, but it really shows you that hopefully as we go forward, we're going to understand more of the genetics. We'll know whether that person is genetically predisposed to have their blood lipids affected by the dietary cholesterol. So there's lots of things to think about there. A few of the medications to think about. If you think of all the different aspects, people can be on multiple medications in order to treat their cardiovascular disease. Triglycerides often don't get mentioned quite so much, very much related to sugar and alcohol. So that may be something, if triglycerides are particularly high, we might want to be particularly careful of our questioning about alcohol consumption. It is not a foregone conclusion, but it's often something that is related.